Hello everyone, my name is Kinnari Nakrani and today I will discuss an article which is Feasibility of Early Physical Therapy for Dizziness After Sports Related Concussion. This study was published in Willy Journal in the year of 2016. This is double-blind and randomized control trial, and now let's start with the introduction part. The estimated incidence of the sports-related brain injury is up to 3.8 million traumatic events occurring each year in United States. Concussion is regarded as a functional, not a structural brain injury, and therefore it is not observable with readily available imaging techniques. The most frequent complaints after concussion are headache, dizziness, posture or balance disturbance, neck pain, emotional, cognitive and sleep disturbance. There were two specific objectives of this study. The first one was to assess the feasibility of recruitment and retention of participants, protocol resource management and participant safety. And second one was to estimate the size of the effect between two treatment groups for the recovery rate of the participant. The inclusion criteria of this study were patients who reported symptoms in migraine cluster with score of at least 3 on a 7-point Likert scale for the dizziness, and also patient with a history of previous concussion, learning disorder, attention deficit hyperactivity disorder. Participants excluded from this study if they are not being managed by sports medicine provider or their symptoms did not meet to the threshold of the inclusion or they sustain a conclusion from a motor vehicle accident. Total 41 participants were randomized into this study and were seen for the physical therapy at the beginning at the 10 days of post-concussion. For the subject, in the experimental group, intervention like manual techniques including soft tissue release, mobilization, thrust manipulation, vestibular rehabilitation technique including habituation and adaptation, oculomotor control, neuromotor control including proprioceptive and kinesthetic awareness, and balance exercise were given by the physical therapist. And for the subject in the control group received an sham subtherapeutic non-progressive therapeutic technique to minimally progressive therapeutic technique. Each session lasted between 30 to 60 minutes and each subject received treatment by study physical therapy twice per week. This study has two primary outcomes. The first one was medical clearance for return to play and second one was symptomatic recovery. Statistical analysis shows the median number of the days to medical release for those in experimental group was 15.5 and for those in the control group was 26, and the median number of days to post-concussion scale recovery was 13.5 for those in the experimental group and was 17 for those in the control group. There was a significant faster symptomatic recovery rate for those with the previous concussion than those without. This was an interesting and unexpected finding of the study, and authors do not know about the actual reason for this, but they hypothesize that participants with the previous concussion are more aware about their symptoms. So, the participant with the previous concussion can recognize and report their symptoms faster than the participant without previous concussion. Now let's talk about the strength of the study. This is the double-blind randomized control trial, and also this was the first study done on the effectiveness of the individually prescribed progressive physical therapy intervention including manual technique, vestibular rehabilitation, oculomotor and neuromotor retraining in the acute phase of the recovery after the sport-related concussion. Limitation of this study include there were no true date for the symptomatic recovery for the post-concussion scale, as the treatment was given only twice per week. So if participant has early recovery of the symptoms, they have to wait till next therapy session. And also future studies should explore if it is safe to begin treatment earlier than the 10 days of the post-concussion. It would be very interesting to see the effect of the physical therapy or any other physical treatment right after concussion. Now at last, the conclusion of the study was individually prescribed progressive physical therapy intervention including manual techniques, vestibular rehabilitation, oculomotor and neuromotor retraining delivered to individual while symptomatic beginning as early as the 10 days after sports related concussion may be effective in shortening recovery time over prescriptive subtherapeutic physical therapy treatment. Thank you so much.